Hi, I'm Peter Lio. I'm a clinical assistant professor of dermatology and pediatrics at Northwestern University, Feinberg School of Medicine in Chicago, Illinois. We are lucky that we have had some really great guideline updates in the last couple of years, and then some even further updates in the adult guidelines just in the last year because things are moving so quickly. But there's a gap because they often do not really focus on pediatrics. And that's important because the rules do not always apply equally. Some of the medicines are only approved down to age 12, others go a little bit lower, but it's a little bit confusing. So we feel like this is going to be a big opportunity to focus on arguably the most important group because we know kids are disproportionately affected by atopic dermatitis, and there are all these extra caveats and things we have to keep in mind. So this is going to be an exciting guideline. But I think the preview mostly is that it's going to be a lot of the same concepts, but some of them are going to be distilled down in a way that I think makes it a little more friendly for those taking care of kids. I think one of the big questions that comes up is the longer term repercussions and implications for kids. And that obviously doesn't usually come from the patient, but it comes from the family. The parents are saying, if we're going to start a systemic agent, what is the time course for this? Is this the rest of their life? If it's a 2-year-old child, that's a big deal, right? It's a different story if it's a 56-year-old adult who has some different options and has a different sense of self and where they're at. This is a bigger decision. So I think those kinds of questions about timing, about potential long-term side effects, not just the short-term ones, about effects on growth, development, the ability to go to school, all of these pieces, they play a much bigger role. And I think in general, what we see is that the tolerance for risk, that threshold is much lower. People are more concerned about even the potential for things. And we know some of the risks can be kind of scary sounding, everything from cancer to blindness to all of these issues. So I think families really do often get more animated about this and have a lot more questions. So we really want to try to arm clinicians so that they're comfortable, that they can really explain these well in a way that makes for good shared decision making. Absolutely. Seeing pediatric patients is definitely its own juggling act. And you're right, you have multiple stakeholders present in the room or sometimes on the telephone, and you have to follow up with them later. There's a lot going on. So I think it is challenging, but that's part of the art where you really are having to pay attention to the patient themselves, so long as they're old enough to have an opinion. And many of them are. Even a 3-year-old can have strong opinions about shots and about the way a cream feels, and that can affect the shape of our treatment plan, but also making sure the entire family's on board. And oftentimes there's 2 parents and they can sometimes disagree, and that's really challenging. Or a situation where the parents are divorced. Now it's even harder. Sometimes somebody's doing it remotely and somebody's live and they're arguing. So all of these are parts of the puzzle that we have to solve, but we really do have to solve it. And I think I keep bringing it back to what is best for the patient, what is best for the family. We're all working together. I often say this little quote that I made up a few years ago: my desire to get you better or to get your child better is far greater than my ego. So I'm not trying to be right. I'm not trying to win an argument. I'm trying to do the right thing. And I think that disarms everybody. And we all realize we have to work together because it's about health. We're not doing this for fun. I am a big nerd for topical therapy, so I'm just so grateful that we have so many wonderful new non-steroidal options, many of which are now approved down to age 2. So this is super exciting. I hope we can even get lower indications, so below age 2, because clearly we have babies that are affected, and I'm really trying to minimize the use of topical steroids, and I have so many families who come in very concerned about that. I'm not anti-steroid. I use them probably more than most clinicians, but I like to be able to really temper their use and use them wisely and be a good steward by having non-steroidal options. So I love that. Of course, I'm also excited by the systemic options, which are clearly life-changing. And it's so cool being old enough now and having practiced long enough that I literally can tell you, just a few years ago, we could not get certain patients better. We were stuck. We were just at the end of the rope. And now we've watched sometimes literally those exact patients a few years later now have an option to them that has changed their life. That's incredible.